10 Early Symptoms of Diabetes, do not ignore them. Diabetes mellitus, diabetes, according to the International Journal of Health Sciences, is a major public health issue that has reached epidemic proportions around the world. Type 2 diabetes is the most common. According to the Centers for Disease Control and Prevention, CDC, type 2 diabetes affects 90 to 95% of diabetics in the United States. Type 1 diabetes affects only 5% of the diabetics. Diabetes, if left untreated, can lead to major health problems such as heart disease, blindness, renal failure, and eventually amputation of limbs. Diabetes continues to be the 6th leading cause of death in the United States. Diabetes, particularly type 2 diabetes, has many early signs that aren't always obvious. In fact, the onset of signs and symptoms can be so slow that people may have type 2 diabetes for years before being diagnosed. In this video, we share 10 signs of high blood sugar level which you must not ignore. As early treatment of diabetes can prevent serious illnesses, it is important that we are aware of the signs and symptoms and consult the doctor to seek treatment early. Enjoy the video, then give it a like and share it with your friends. This will help the channel. If you are new to the channel, subscribe to the channel and hit the notification bell and you will be informed of new videos. Number 1. Frequent urination, polyuria. Do you always want to go to the toilet to ease yourself? If you do, you could have a condition called polyuria wherein your body makes more urine than normal. Adults produce approximately 3 liters of urine per day. However, if you have polyuria, you could produce up to 15 liters of urine every day. It's a classic diabetic symptom. An overactive bladder, an enlarged prostate, and urinary tract infections are just a few of the disorders that make you need to urinate more frequently. They can make you feel as though you need to go all the time, even if your bladder isn't full. Polyuria, on the other hand, makes you need to go to the bathroom more frequently because your body produces more urine. In some cases, it may lead to dehydration. Polyuria is one of the first indications of diabetes. What causes polyuria? If you have diabetes, the sugar level in your blood is high. Your kidneys will have to work harder to get rid of it. This forces them to make more urine and you have to pee frequently to get rid of the high volume of urine. Furthermore, the frequent urination will make you feel thirstier and you will want to drink more. When you sleep, the urge to pee doesn't go away. You will wake up frequently during the night to pee. Number 2. Frequent drinking, polydipsia. Polydipsia is a condition in which a person drinks a significant amount of fluid, usually water, in reaction to acute thirst, though there can be other reasons for this. Thirst is your body's attempt to restore fluid equilibrium that has been disrupted by conditions such as dehydration. Polydipsia can be caused by a variety of medical conditions, the most common of which being diabetes. Polyuria, or frequent urination, is frequently connected with polydipsia. Number 3. Increased consumption of food, polyphagia. One of the 3 main indications of diabetes is polyphagia, which is a medical word for excessive hunger or increased appetite. You may wonder, what causes this increased appetite? Your body converts whatever you eat into glucose. It then employs the hormone insulin to transport the glucose produced from your bloodstream to your cells. The cells then utilize this glucose as fuel to go on with their normal operations. In diabetes, the body is either unable to make insulin, type 1 diabetes, or is unable to properly utilize the insulin that is produced, type 2 diabetes. As a result, the glucose produced from your food stays in your system for longer and is excreted through urination. This means that cells are deprived of the energy they require to perform properly. When this happens, your cells send you a signal to keep eating so they can acquire the nutrients they need. As polyphagia is characterized by abnormal eating habits, the hunger does not go away by eating normally. Consult your doctor if you are not following an aggressive workout or fitness plan but yet feel compelled to eat all the time. Number 4. Extreme tiredness, fatigue. Extreme tiredness and exhaustion, fatigue, that do not go away with rest or sleep can be a symptom of diabetes. It's fairly prevalent, with research showing that 85% of diabetics suffer from fatigue. One of the causes of fatigue for a diabetic person is the high blood sugar level. High blood sugar levels due to lack of insulin hormone or insulin resistance can impair the body's capacity to absorb glucose from the blood into cells to meet our energy needs. Number 5. Blurred vision. Blurred vision is one of the common signs of diabetes mellitus. Blurred vision refers to a loss of sharpness of vision and the inability to see minute details. Blurred vision can affect either one eye, unilateral blurred vision, or both eyes, bilateral blurred vision, and it might happen frequently or infrequently. High blood sugar levels caused by diabetes can impair your vision by causing the lens inside your eye to expand, resulting in temporary blurring of vision. Vision blurring can also be caused by extremely low blood sugar levels. If this is the case, once your blood glucose levels have returned to normal, your vision should return. Number 6. Unexplained weight loss. Unexplained weight loss is one of the warning signs of diabetes. Weight loss that occurs without dieting or exercise is referred to as unexplained weight loss. It is common in persons before a diagnosis of type 1 diabetes but can also occur for persons with type 2 diabetes. If the unexplained weight loss is significant, more than 5% of your weight over a period of 6 to 12 months, and if you have other signs as discussed in this video, then you should consult a doctor. What causes the unexplained weight loss? As discussed earlier, for persons with diabetes, a lack of insulin stops the body from transporting glucose from the bloodstream to the cells, where it can be used as energy. When this happens, the body begins to burn fat and muscle for energy, resulting in a loss of overall body weight. Another cause for weight loss in people with diabetes is that their kidneys have to work harder to get rid of the high levels of blood sugar in their bodies by producing a lot of urine. This leads the kidneys to use even more energy, resulting in further weight loss. Number 7. Cuts and wounds take a long time to heal. When a person has diabetes, wound healing can be hindered. The wound heals slowly and can quickly deteriorate, necessitating regular monitoring. The high blood sugar level in a diabetic person causes the arteries to harden and the blood vessels to constrict. Blood flow and oxygen to a wound are reduced when blood vessels are narrowed. A high blood sugar level also impairs the function of red blood cells, which transport nutrients to tissues. This reduces the effectiveness of infection-fighting white blood cells. A wound heals slowly if it lacks appropriate nutrition and oxygen. Number 8. Lack of sensation. Nerves in the body are impacted when blood glucose levels are out of control, and the person may experience a lack of sensation. Diabetic neuropathy is the medical term for this condition. People who have lost sensation are unable to detect a growing blister, infection, or surgical wound issue. As the person may be unable to detect changes in the condition of a wound or the actual wound, the severity of the wound can worsen, leading to healing difficulties. Number 9. Dry and itchy skin. Do you have dry and itchy skin? They may be the first indicator that a person has diabetes in some cases. Diabetes causes the body to lose too much fluid through urine and skin evaporation. As a result, you'll have dry, itchy skin that's both unpleasant and painful. Poor blood circulation, which is prevalent among diabetics, can also cause itching, especially in the lower legs and feet. Number 10. Acanthosis nigricans. If you notice that the skin in the armpits, groin, and back of the neck is thickening, then you have a skin condition known as acanthosis nigricans. This skin disorder causes dark, velvety darkening in the folds and creases of the body. This skin condition affects persons who are overweight or diabetic. The skin changes usually take time to manifest. There may be an odor or itching on the affected skin. This skin condition is due to insulin resistance. Insulin resistance is what leads to type 2 diabetes. Advice: if you have any of the above signs or symptoms, consult your doctor and get your blood sugar level tested. Early detection and early treatment can save you from more serious illnesses. Enjoy the video. Do share if you or any of your friends have seen the early signs and symptoms of diabetes and taken early action on them in the comment section below. We love to hear from you. And if you liked this video, then make sure to click the like button and subscribe to the channel so that we can keep coming up with your favorite content.